Sarcoma is a rare and complex group of cancers where we see approximately 2,600 cases within the Australian context. Sarcoma is a type of cancer that originates within the supporting structures of the body. So supporting structures of the body are the things that keep you up, like bone, muscle, fat, soft tissue and cartilage. And because there are so many different types of supporting cancers, there are approximately 100 different subtypes of sarcoma, each rarer than each other.
One of the issues we've had with sarcoma patients is lack of awareness from patients themselves, but also from health professionals. So for instance, some patients are often present to GPs multiple times before the GP suspects that something more serious is going on. And similarly, patients themselves can have some problem with one part of their body and really not pay too much attention to it until the tumour has grown very large.
My name is Dr. Jeremy Lewin. I'm a medical oncologist specialising in sarcoma at MacCallum Cancer Centre. I'm also the medical director of the Victorian Adolescent and Young Adult Cancer Service, which specialises in supporting young people, and I'm the research and education lead for sarcoma within the VCCC. I've had a 15-year career investing and supporting patients with sarcoma in trying to optimise their outcomes. Sarcoma is a rare and complex group of cancers where we see approximately 2,600 cases within the Australian context. Sarcoma is a type of cancer that originates within the supporting structures of the body. So supporting structures of the body are the things that keep you up, like bone, muscle, fat, soft tissue and cartilage. And because there are so many different types of supporting cancers, there are approximately 100 different subtypes of sarcoma, each rarer than each other.
I can't imagine what it would be like. I mean, you were just 16 at the time, Tessa. Your GP, as I understand it, hadn't even heard of the type of cancer sarcoma before, is that right?
Yeah, that's right. So when I initially connected with the GP, although he kind of was really keen to explore what it was, he hadn't ever seen someone with sarcoma before.
Because of the rarity of sarcoma, patients can present in different types of ways, but often with a lump or with pain within a lesion. We know that the treatment is very leveraged on when they present. So for patients who present very early, treatment may include an operation or just a simple removal of the lump. But as lesions present with more extensive disease or in certain types of subtypes of sarcoma, we may need much more complicated types of treatment such as chemotherapy, radiation and a combination of additional treatments.
My name is Vivek Bhadri. I'm a medical oncologist and work at Chris O'Brien Lifehouse and Westmead hospitals. I'm also a board director on the Australia-New Zealand Sarcoma Association. ANZSA is the peak body for sarcoma research and advocacy here in Australia. It was forged out of the merging of two entities, the Australian Sarcoma Study Group, as well as the Australasian Sarcoma Group, and it came together to form ANZSA in 2017. The mission of ANZSA is to improve the outcomes for sarcoma patients through research, education and awareness. We currently are a multidisciplinary organisation made up of physicians, surgeons, radiation oncologists, as well as basic researchers, physiotherapists, allied health and nursing. We also have a large consumer panel as well, so we cover all aspects of sarcoma care through from the patient perspective all the way through to basic research. The organisation itself is a not-for-profit charity organisation that has a board comprising of 12 members of multidisciplinary skills, and we have a membership of about 300 people currently. One of the ways we've tried to raise awareness of sarcoma is, in fact, to insert sarcoma training into the curricula for various different specialist colleges. Because sarcomas only account for less than 1% of all adult cancers, they often don't get any there's no place for them in the training, the official training programs. But what we have tried to do is to liaise with the College of Pathologists, radiologists and surgeons to raise awareness of sarcoma, to include sarcoma in their teaching, such that, for instance, if an MRI is done, the radiologists who look at the MRI have a higher index of suspicion if something looks like a serious sarcoma. And then, more importantly, or just as importantly, consider referring that patient onto a sarcoma centre.
Although sarcoma can occur at any age, it is exceptionally rare, but we know that within children and adolescents and young adults, they are certainly overrepresented within the sarcoma cases. So although only 1% of sarcoma is seen in adults, when we see in the adolescents and young adult years, it's approximately 10 to 15% of the cases that we see, and about 10% of the cases that we see in young children. Survival remains, dismally low, with approximately a 50% 10-year survival, really recognising the importance of trying to improve outcomes within this young population.
One of the problems with sarcoma is that there is no key defining symptom that patients will automatically think this is something serious. So one of the issues we've had with sarcoma patients is lack of awareness from patients themselves, but also from health professionals. So for instance, some patients are often present to GPs multiple times before the GP suspects that something more serious is going on. And similarly, patients themselves can have some problem with one part of their body and really not pay too much attention to it until the tumour has grown very large. So one thing we would say is that if a patient or if someone finds something on their body that is a lump that is greater than the size of a golf ball, really they should go and get that checked out as soon as possible. And for GPs, if someone presents with ongoing bone pain that doesn't respond to simple over-the-counter medications, to consider further investigation as that patient may have a bone sarcoma. Most of the funding that we see in cancer care goes to the big tumor groups, the breast, lung, prostate and bowel, because that's where most of the patients are. But if we look at rare cancers as a whole, they still comprise up to 40% of all patients, of which sarcoma are a small part. But the sarcomas disproportionately affect children and young adults, and any death in that age is a great loss to Australia for the future.
Because of the rarity of cancer, and particularly sarcoma within a young population, we certainly recognise that time to diagnosis can be very, very long for a young population, and in approximately a third of cases there can certainly be misdiagnosis. We need to invest heavily within research, not just from the pre-diagnostic phase, but also once they're diagnosed, to try and optimise outcomes. And certainly we know there is a clear correlation between the ability to put young people onto clinical trials with sarcoma and their overall outcomes. So one of the best ways that we can improve outcomes with a young population with sarcoma is to heavily invest within clinical trials.
Well, we know that the only way to improve survival rates is through clinical trials, and clinical trials need a decent amount of funding. Sarcoma clinical trials are a little bit different because we can't usually run our own within Australia clinical trials due to the numbers of patients that we see. So we often have to collaborate with European and American sites. One of the issues with that there is that sometimes the trial may be funded in Europe, but there will be no funding for the sites in Australia, or in the US, but not in Australia. So whilst we may have access to clinical trials, actually having the funding to support the running of the trial in Australia is problematic. We rely often on philanthropic funding, but actually getting good government funding is very difficult for our trials.